Thanks everyone for being here. It's always interesting following Dr. Josh because he always comes up without slides and we have a lot of overlap in our presentation, so I always have to jab and weave and try to figure out so we don't duplicate ourselves. We have some similarities, but certainly some differences. As was mentioned, I am in Southwest Florida. I've been practicing there since 2002, joined a multi-specialty group and started a satellite office for that group. After 2 years of being in that clinic, I decided I didn't like the group mentality, ended up buying the clinic, or buying my practice from the group and going solo. But after several years of doing the same thing that all of you people are doing in the trenches and day-to-day dealing with step edits and prior authorizations and refusals and just all the nonsense that we have to deal with, we would sit down at the end of the day and just say, there's got to be a better way. There has to be a better way for us to provide better care and not kill ourselves and be constantly fighting and haggling with somebody that's telling us how we're supposed to be taking care of our patients. Well, you might look at the name of our company and say Epiphany Health. That sounds like a religious name. Why is a medical practice called Epiphany Health? Well, one day I got a phone call from one of my colleagues and he said, I just got one of the most interesting phone calls from one of my patients. He owns a heating and air conditioning company. And he said, Doc, I have 10 employees and every single one of those employees sees you as their primary care doctor. He said, but I pay about $1,000 per month per employee for them to see you. Why don't I pay you directly to take care of my employees? And then I'll take out a high deductible health plan on them. And even if I pay their deductibles for them, I'm still likely to come out ahead at the end of the year. And he called me up and he said, what do you think about that? And it's like, bing, it's like, the light went off and said, this is simple. What would we need to do in order to work directly with the employees, directly with the employer? Again, we need access to affordable things that a primary care doctor does. We need access to cheap labs. We need access to cheap drugs. We need access to cheap imaging. We need access to cheap physical therapy. Because what we do in our office is cheap. We're talking about a $1.50 hypodermic syringe, a couple dollar EKG pads. I mean, this is not break the bank type stuff. So why are we charging so much money for all this stuff? So we had our epiphany. That it really is the third-party paying system that really drives up the cost of care. And I know Josh touched on this stuff, so I'm really not going to go into these details, but we also have a direct primary care membership-based program where our patients pay us a flat monthly fee for their services. Unlike Atlas MD, Dr. Josh stepped right out of residency training and started with 0 patients and did something that most people would be terrified to do, and I applaud him for that. But I think even equally as terrifying is somebody with a full practice telling all their patients to go away, and oh, by the way, if you want to come on back, this is what you can pay me to come on back. That's terrifying.
More terrifying.
Yes. And if you're married, you got to get that one past an approving body as well. So if I were to tell my wife, oh, by the way, I'm terminating 3,500 patients and we're going to start a new practice tomorrow, that conversation would not go over very well. So we have a traditional practice. I see Medicare patients. I see traditional third-party insured patients. I have a full practice of about 3,000 active insured patients. But what we did was we added our direct primary care as a hybrid onto our existing practice, mostly to reach out to the uninsured within our practice. Every practice has a group of people that are uninsured, more than likely, and so that's just low-hanging fruit for you to just go in and sign these people up, and from day one we flipped the switch. We had 20, 30 patients sign up on day number 1. But unlike Atlas MD, we didn't have the time or the resources to do pharmacy, because we have a full practice of patients. We just don't have the resources to operate a pharmacy. So we contracted with mom and pop pharmacies in our community. And we got a deal with them and said, okay, we're going to pay wholesale plus 2%. And we signed a contract with them. For our patients, if they come in, it's wholesale plus 2%. And that way, let the pharmacy be the pharmacy. We get nowhere near the rates that you're getting. We're not seeing that sort of stuff, but we're still paying cheap. We have the same contracts with Quest and LabCorp to get labs pennies on the dollar. We reached out to our local radiology independent practices and said, If you had a patient, if our patient comes to you and agrees to pay cash at the time of service, you don't bill, you don't have to collect, what's a fair price? And that question came up earlier, what's a fair price? Until people are giving prices, we don't know. And I've talked to Keith Smith about this many times, and he said, I won't know what my fair price is until somebody starts competing with me, then we'll be able to establish what a fair price is. So time will tell what a fair price is for those things, but I tell the radiologist, give me a price that when my patient calls you up, you don't cringe thinking this is a charity case, okay? We're not trying to offset, we're not shifting risk from the insured patients to the uninsured patients. We're saying, tell me what you think is a reasonable price, and just put it on paper for me, write it down. And so we've done the same with our cardiologists, we've done the same with our physical therapists. So I can get a physical therapy session for $35. My patients that have Blue Cross, they're gonna pay a $50 copay. So I can get it cheaper if they pay cash than if they pull out their insurance card. And there was just an article by Kiplinger, I think, that just the other day, that talks about how much money you can save if you actually leave your insurance card in your pocket. We see this every single day. So one of the things that you hear in people that are really supporting the Affordable Care Act is, we tried the free market didn't work. The free market is why we got where we are. There is nothing free market about what we're doing. I mean, there is no free market in medicine today. But in a true free market system, this is an example of a 32-inch LCD television screen that comes to market. It might come in at $725, but after several years, more competition in the marketplace, better manufacturing techniques, before you know it, that's a $200 Black Friday special at Walmart. But what happens with competition in healthcare is this. So I trained in Cleveland, where we had the Cleveland Clinic right across the street from University Hospitals of Cleveland. Both hospitals consumed multiple city blocks with multiple skyscrapers. They each own their own hotels, their own Gamma knives. Tremendous competition. But they're just doing a lot of really expensive stuff. But they're not doing anything to actually bring down the cost of care with that competition. Now, take another example of what happens with an ophthalmologist doing LASIK surgery versus doing cataract surgery. An ophthalmologist that's doing cataracts, the cataracts are again, the prices of these things are going up just like everything else in healthcare. The prices are getting more expensive. So now you're having to charge extra for the lens upgrade and those sorts of things. But LASIK eye surgery has been flat priced, if not come down near 30% in the same time period, done by the same surgeon in the same facility with the same staff. So why is that? Well, it's because LASIK's not a covered service. LASIK's paid out of the pocket by the patient. Now you can probably get a buy one, get one on Groupon. So, Josh mentioned about, you don't buy health insurance to replace the light bulbs or to mow your lawn. Why would you buy health insurance to pay for primary care services? These are routine things that everyone should expect to come out of pocket to pay, and we should be able to make it affordable for everybody. And so when you take healthcare services and you bundle them all into a box and say, we're going to sell everything together, and we're going to call this box health insurance. And we're going to put affordable primary care, cheap stuff into this box and sell it with chemotherapy, bypass surgeries, pacemakers. It's all got to be bundled together. When you put it all together, it props up the cost of primary care and makes it a barrier to access for routine services. But if we can go ahead and pull all that other care off, the price of health care for primary care services comes crashing down to a very reasonable level. And the reality of it is that we don't really refer a whole lot of patients out. We do a lot in our office. So a couple things I want to say here is that, I travel around and meet with a lot of legislators. We've been to Washington several times. And one of the biggest things that I hear now that the Affordable Care Act is rolling out is, wow, these deductibles are insane. How can you call this stuff affordable? Well, there's nothing in the Affordable Care Act to bring down the cost of health care other than the rationing board that hasn't even been established yet. So now what comes out is you have these very expensive, bloated, high-deductible health plans that they're bloated because they cover things that people don't want, so they're very pricey, unlike the former catastrophic policies. But now, again, you've made an affordable policy expensive but still kept the deductibles high. But I have to remind the folks, the conservative folks, is that your solution is a high-deductible health plan with a health savings account. So you're complaining about the exact thing that you're proposing. So you can't have it both ways. So you've got to put something, there's a missing piece there that has to allow people access to routine care. And I believe the direct primary care is that missing piece. So our fees we have two different types of programs. Now that the Affordable Care Act is rolled out, some of the things that we included in our traditional package are now mandatory in insurance for free, so people don't want to pay twice for that. So we have a program for people that have health insurance and a program for people that don't have health insurance. So for the people that have health insurance, we charge $50 for adults, $25 a month for the first child, and $10 a month for each additional child. Just like Josh's practice, once they pay that monthly fee, they pay nothing for anything in our office. So all the things he mentioned, we do it for no added fee. Now the patients that have no insurance, we charge $80 a month for the individual, we charge $150 for a couple, and $175 for a family, no matter what the size. So what we include in that sort of thing, again, if you're signed up just for our basic plan with your insurance, it'll just include what we do in the office. But if you sign up for our expanded package for the people that don't have health insurance, we include a pap test in there, we include a mammogram in there, we include routine blood work in there, we include the flu vaccines, again, routine blood work. So basically all the stuff that most people need on an annual basis, we throw in there as well. The only thing, we don't exclude for any pre-existing conditions, we don't mark up for pre-existing conditions. The only thing we don't do is we don't prescribe chronic pain medications and chronic controlled substances, and that's in our contract. It's also in our contract that our patients only get the prices from our partners if they pay at the time of service. So I'm not going to go through all that stuff. This is an example of some of the savings that you're going to see from some of our partners if you go there. I don't know how well you can see it on the screen there. So a CT scan of the chest with contrast is about $200. Our MRIs, it's not on that screen, but a lumbar spine MRI is about $200. Our routine plain x-rays are all in the $20 range. Ultrasounds you can usually get from $40 to $60 for routine ultrasounds, vascular up about $100. Colonoscopy at $1,100. Now $1,100 sounds like a lot for something, but keep in mind, most people only need this every 10 years. And if you went to a hospital for this, you'd probably pay $5,000 to $7,000 for this. You're not going to be able to see this, but this is an actual hospital bill from a patient of mine that went to the emergency room for abdominal pain. This happens to be a hospital of which I'm on the board of trustees from, so this doesn't make this bill feel any better. But when you itemize that bill out, you can see, breaking it down, that the total bill came to $19,723. Okay, for labs, chemistries, hematology, chest x-ray, CT scan, and the ER fee schedule. If that same exact patient came to our office and paid cash for all the exact same stuff, and we can see people same day, we can get stat CT scans, we can get stat labs just like they can in the ER, the facility's right next door, that patient would pay out of pocket $278 if you can't see that in the back, okay? One of the very first patients I signed up for this program, she had rheumatoid arthritis and she was seeing a rheumatologist. The rheumatologist gave her an order for some blood work. She went to the lab and the lab quoted her $1,800 for the labs. And she called us up and said, I thought I'd get a discount for this stuff for being in your program. We said, we do, you just have to go through us to get it. Her labs came down to about $80. Okay, so for just that one lab alone, she paid for almost 2 years of membership in our program. Now she can afford to see the rheumatologist, she can afford her medications because she's not overpaying $2,000 for blood work. So back to this employer of 10. If this employer paid for an Epiphany health plan plus a high deductible health plan, let's say a $10,000 catastrophic policy. Okay, that black number across the bottom is how much that would cost over 10 years for that, I'm sorry, this is a family of 4, over 10 years. Again, if they paid a $10,000 deductible and Epiphany membership, so they're not paying anything for the routine care, they're only paying for stuff outside of our office, they cost them $51,960 over 10 years. Now, if they used a traditional PPO and paid for the PPO, their cost for that PPO over 10 years is $220,000 based upon 2013 numbers. So their net savings would be about $170,000 over 10 years. Okay, so that's a lot of money. Now let's just say this is the sickest family on earth, and they hit that $10,000 deductible every year for 10 years. Look at that 168, take the 1 off of it, and they still saved $68,000 by basically insuring themselves with a safety net of that catastrophic policy. That same company, they'd save $1.7 million over 10 years by self-funding, as we were talking earlier. And Jay and I have been talking about this for a while, self-funding. If we could get that to small businesses, that market is wide open. 95% of employers over 1,000 employees self-fund. Only about 15% of employers under 50 employees self-fund. That's an untapped market that's available for this entire room to go after. We just got to figure out a way to make that happen. All right, I'm just going to wrap this up real quick here. Anybody in the room ever hear of Ovick Roy Forbes, apothecary? He was Mitt Romney's senior healthcare policy advisor. He wrote a book about how Medicaid fails the poor. And in that book, he referenced our practice and priced it out that instead of everybody being forced to buy health insurance under the Affordable Care Act, instead of everybody, the projected cost for that would be about $1.8 trillion over 10 years. I'll wrap it up in just a second. The projected cost of that would be about $1.8 trillion over 10 years, still leaving about 28 to 30 million uninsured. And most of those people are on Medicaid, which nobody takes, so it's a card that accesses nothing. So instead of doing that, we enrolled all 58 million people that were uninsured into our program. We get 100% that now has care. We would save $1.2 trillion in coverage for everybody, or access to care for everybody. Real quickly here, we have the way our company is set up and the way we can do a hybrid without violating all of our contracts with our insurers is Epiphany Health is a separate company that's almost acts as a third-party administrator. It's not an insurance company, but it contracts with the patients. Then our practice contracts with Epiphany Health to provide care at the agreed-upon rate, which is the monthly membership fee. So it's just a pass-through company that, from the perspective of our practice, it's no different than what if we signed a contract with Blue Cross or somebody else. So it's a separate entity that exists that you could plug any practice in anywhere. I want to touch on this real quick because this is one of the key things between Josh and I here is that, again, this is a hybrid practice. I'm busy, okay? I see a lot of patients, but it's the Epiphany patients that come in our practice, the membership-based patients, probably account for about 10% of my office visits, but depending on the month, 30 to 50% of my revenue. That's how, out of a community of 60,000 people, I am we're the largest city. Actually, we just passed the city of Sarasota in population. I'm the last independently practicing primary care doctor in my community, only because of this program. Okay, it kept us alive. So now we're in a position that at any point in time, we can cut off any third party we decide to. So we transition as we feel comfortable. I can tell you that about 70 days ago, we terminated a United Healthcare contract. Said, you implemented, they implemented a lab benefits management program that required prior authorizations for Pap tests, routine blood work, and cultures. And that was the last straw. We're done. I can tell you they have threatened a lawsuit. We'll see how that goes. They have not filed anything yet, but they certainly said that we were in violation of our contract and they were going to proceed. They also said they were going to cut off my payments, but they haven't done that in 70 days, so we'll see how serious they are about that. So the pros of doing a hybrid is that there's zero risk. If you don't sign up a single patient, you've lost nothing. You don't have to take out any loans to sustain yourself and hope that this thing goes. The downside is that you're busy. You're kind of competing against yourself because you're telling a patient, I want you to sign up for my practice and pay me a monthly fee, but I'm going to allow you to use your insurance card for a $10 copay as well. So, they're going to use that $10 copay until I don't have to anymore, until you're telling me I don't have to anymore. So we projected retaining about 10% of our United Healthcare patients. It looks like we're on track to do that. I can tell you that in 70 days, we've only received one records release request after we sent out the letters. So I don't know what the rest are going to do, if they're waiting until they need to come in, if they're going to pay fee for service, go out of network, or what they're going to do, but we'll see. But we're on track to get the 10% that we projected to keep. And with that, I'm going to go ahead and turn it over to our next speaker. And I'm sticking around for questions, and I'll be here all night as well.